Hi, I'm Dr. Saqib Mansoor, and today's topic is the posterior triangle of neck. So, to study that, we'll study the extent of the neck and various structures and divisions of the neck. So, you see here, we identify this cranium and this lower part of the mandible and the occipital bone lower part. You see, look at that, and this bony portion superiorly and the clavicle inferiorly. So, and these two muscles, the sternocleidomastoid and this is the trapezius, right? So these structures are identified in this picture. This is the mandible, lower part. This is the occipital bone, lower parts. This is the lower part of the cranium, and this is the inferiorly upper part of the clavicle. So this is the sternocleidomastoid, and this is the trapezius muscle. And this, you know, these muscles are often and quite almost always palpable and visible. These muscles are palpable and visible. So involving these bony features and these palpable and visible muscles, the sternocleidomastoid and trapezius, we can easily divide this region of the neck into various parts, at least four parts. And one is that this is the sternocleidomastoid part, they say. Then is the anterior triangle, the area anterior to the this sternocleidomastoid. Its anterior border is the anterior triangle of neck, and the area posterior to that, posterior border of the sternocleidomastoid is the posterior triangle. So this is the thing. And then you can see the other parts as well. After this, we can study this is this lateral side of the neck, and this is the anterior side of the neck. And these are the divisions enlisted. Sternocleidomastoid region in the region of the neck first, then is the posterior cervical region, which contains the trapezius and the cutaneous branches, the dorsal rami of the spinal cervical nerves. And then is the lateral cervical region, which is in fact the posterior triangle. And today I am focusing on this posterior triangle to discuss with you. And then is the anterior cervical region, which is the anterior triangle. And you see these triangles, this anterior triangle and today's topic posterior triangle, they are further subdivided. So as we move on, we can discuss how they are further subdivided. You see, this is a muscle. This is omohyoid. This is the omohyoid. This is the this is also omohyoid. This is the superior belly of omohyoid muscle, and this is the inferior belly of omohyoid muscle. So how it divides this posterior triangle into various parts, I will explain in a short while. And first we move to this picture. So you see a lateral side of the neck, or you can say side of the neck. It's tell we can discuss its like boundaries. Like this anterior is the anterior median line. Anterior is the anterior median line, and posteriorly is the trapezius. This trapezius, you can see it's the anterior border, and superiorly this mandible, lower part, the base of the mandible, and this is the angle of the mandible. And we draw a line extending from this angle of the mandible to this mastoid process. This is the mastoid process, and going to this this is the superior knuckle line reaching up to the external occipital protuberance. So this is the area, this which is divided, of course, beautifully by this obliquely placed sternocleidomastoid into anterior triangle and a posterior triangle. So here I am telling you this is a posterior triangle further subdivided by the inferior belly of the omohyoid into this D, which is the our this two portion, which are the our this occipital triangle. This is the occipital, of course, near the occipital bone. Of why this is called occipital triangle? Then this is due to the presence of the occipital artery. Occipital artery presence brings the name to the occipital triangle. And this is the occipital triangle lies above to the inferior belly of the omohyoid. And below this omohyoid, this is the second part of the triangle, posterior triangle, which is the omoclavicular or subclavian triangle. Of course, the subclavian triangle owes its name to the presence of the third part of the subclavian artery, which is present over here. And this is the two parts of the this posterior triangle, occipital and this our subclavian. So you see, this is the point, and this is the layout of the our posterior triangle. And this was again, revising the superiorly, this side of the neck, this mandible, the base of the mandible, lower part of course, this angle of the mandible, and a line, arbitrary line, joining this angle of the mandible to this mastoid process, and the superior knuckle line reaching up to the external occipital protuberance, and posteriorly you can say this is this is trapezius, and inferiorly this is the your clavicle. So this is the point, right? So this is the various portions, and the sternocleidomastoid obliquely placed divides it into anterior and posterior triangles. So lateral region of the neck is the posterior triangle. So boundaries I've already told you. So anteriorly is the posterior border of the sternocleidomastoid. Posteriorly is the anterior border of the trapezius, and inferiorly is the middle third of the clavicle between the trapezius and the sternocleidomastoid. You could see, right? This is the your I think this picture is better. You can see this is the posterior triangle. This is the layout, and here you see this is the anteriorly is the posterior border of the sternocleidomastoid. Posteriorly is the anterior border of the trapezius, and inferiorly is the middle one third of the clavicle, and superiorly you see this is the apex where these two muscles meet. Where the this is the apex, where the sternocleidomastoid and trapezius meet on the superior knuckle line of the occipital bone. So this posterior triangle does have a roof, which is formed by the investing layer of the deep cervical fascia, the fascia coli, and there is a floor, which is formed by the muscles covered by the prevertebral layer of the deep cervical fascia. We already had just in the previous lecture the study of this fascia coli with the 6 layers, mentioning in detail the investing layer as well as this pretracheal layer. So you could see these muscles forming the floor of the this posterior triangle. You see, first of all, you see this is the our sternocleidomastoid. This is the trapezius, and the area between them above this clavicle and up to this superior knuckle line and external occipital protuberance. This is the our whole posterior triangle, and the floor is formed by these muscles: splenius capitis, this above, splenius capitis. As we come below, this is the our levator scapulae, levator scapulae. So, and then below is the scalenus medius, right? And not shown here, over here it is present the scalenus posterior. And occasionally there is also present the scalenus anterior. So these muscles form the floor of this posterior triangle. Repeat, this is the scalenus splenius. This is the splenius capitis. Then is the levator scapulae, then is the scalenus medius, then is the scalenus posterior, not shown here, and then is the scalenus anterior. These are the various muscles forming the floor. And between the this scalenus anterior and scalenus medius, and here emerges the brachial plexus trunks. All the 3 trunks emerge here. So this is the point, and here also present in the posterior triangle superficially is the platysma muscle. So this is the thing, and I've already told you, even at this stage, this part of the discussion. This is the identify accessory nerve. You see, this is the very, very important structure lying in the this part of the triangle, this posterior triangle. This is the spinal accessory nerve, right? This is the 11th cranial nerve. Here it is, emerges in front of the this border of the this sternocleidomastoid and trapezius. It goes like this. This is the accessory nerve, right? And at this point, this you have to note already, right? So that is the divisions of the posterior triangle that I've already told you, that the inferior belly divides. This is the inferior belly divides. Below this is the subclavian triangle, and above is the occipital triangle. This is occipital, near to the occipital bone, and this is the this due to the presence of the third part of the our subclavian artery. This is the subclavian triangle or the omoclavicular. Sometimes it is called as a supraclavicular, right? And this is the various portions. Already you can see even this picture very clear again. This is the lower part, smaller part, omoclavicular or subclavian or the supraclavicular triangle, and this is the occipital triangle. This is the point. And here you have to identify, tell you one thing, between the two heads of the, you know already, and I will tell you again. This is the our sternocleidomastoid has two heads, and between two heads there is the this is the lesser supraclavicular fossa. So this is the occipital triangle. A brief discussion, because it's the occipital artery present in that, so it is called as occipital triangle. So I told you this is the most important nerve crossing the occipital triangle is the spinal accessory nerve. This is, I showed you already, this is the spinal accessory nerve, right? So this is then the subclavian triangle. So this is, I told you that there is the supraclavicular fossa present on the surface where this is lying, on the supraclavicular fossa. So inferior part of the external jugular vein crosses this triangle from superficial aspect. The subclavian artery lies deep in it. These vessels are separated by the investing layer of the deep cervical fascia. Due to the presence of the third part of the subclavian artery here, so this triangle is called subclavian triangle. So the contents are listed over here. This is the contents of the our occipital triangle, various nerves and the vessels and the lymph nodes. The nerves, I told you this is a spinal accessory nerve. Then you see four cutaneous branches of the cervical plexus, lesser occipital, greater auricular, anterior cutaneous nerve of the neck, and the supraclavicular nerves, right? And the muscular branches, I first show you the this is the sensory nerves, cutaneous nerves present in the posterior triangle. This is the great auricular nerve. This is the lesser occipital nerve, right? And this is the transverse cervical nerve, and this is the supraclavicular. You know, these are the three supraclavicular nerves: lateral, medial, and intermediate. So supraclavicular, transverse cervical, great auricular, and lesser occipital nerves, cutaneous nerves present in relation to the posterior triangle of neck. Which part? Our occipital part of the triangle, the occipital triangle. So this is, so I've showed you spinal accessory and these four cutaneous branches, the cervical plexus. And then are the muscular branches, motor branches. These are two small branches to the levator scapulae, two small branches to the trapezius, and nerves to the rhomboids, which is fibers are proprioceptive, not motor, right? So this is then the C5 to C6 roots of the brachial plexus. These are the nerves overall present in the this occipital triangle. Spinal accessory, cranial nerve, then the four cutaneous branches, and the muscular branches, these four, right? And then the vessels. Vessels are present are the occipital artery. I already told you that occipital artery is present and giving its name occipital triangle. Then is it transverse cervical artery and vein. Transverse cervical artery and vein. So the lymph nodes, and here are the supraclavicular nodes, and a few at the upper angle are occipital nodes. Two sets of the nodes, supraclavicular and occipital. Now coming to the next triangle, the subclavian, of course, you see the vessels first, I think. This is the third part of the subclavian artery, third part of the subclavian artery and subclavian vein, and the suprascapular artery and vein, and the commencement of transverse cervical artery and termination of the corresponding vein. And last vessel is the lower part of external jugular vein. They're present in the subclavian triangle. And the lymph nodes, a few members of the supraclavicular chain. Then the nerves in the subclavian triangle are the three trunks of the brachial plexus, nerve to the serratus anterior, nerve to the subclavius, and the suprascapular nerve. So you see here to show you this third part of the subclavian artery. This is the, you could see this. This is the third part of the subclavian artery, right? So this is present in relation to this, this is the posterior triangle lower part, which is the our supraclavicular triangle, omoclavicular or subclavian triangle. Subclavian triangle. This is the emerging going up. So this is the third part of the subclavian artery, and its branches are already enumerated in our table. I told you. So this is a point, and this is the one very important artery over here in this part of the posterior triangle. And then is this external jugular vein. You could see here it's going up first. This is the external jugular vein. So one very important vein identified here is external jugular vein, and the most important part, third part of the subclavian artery. The subclavian artery gives it name the subclavian triangle. So now this was a brief overview of the cervical region, the lateral side, the posterior side, the anterior side, right? And the sternocleidomastoid, I told you, and we'll study some aspects of the sternocleidomastoid muscle and diseases as well, like the torticollis and the trapezius as well. And this, I tell you why this division is made, this division of the various neck, because this neck division is made to determine the precise location of all the structures, the vessels, the arteries, nerves, and the veins, and the muscles, and lymph nodes, for an easy description of these things, and to tell where it is located, to relate to its injuries, to its pathologies, so that the thing should be clear in description. That is why these divisions are made anatomically. So this directly relate to surgically and even medicine. So this is the sternocleidomastoid. It's a key muscular landmark in the neck, right? This is the key muscle here. So obviously it is palpable, and you can even it is visible. So it, I told you, divides each side of the neck into anterior and posterior triangle. This is all already done. This to again look at the sternocleidomastoid, and this is two heads. These are the two heads, and this is they join the two heads over here, and they insert over here, right? So we start discussion. The two heads. This is like a tendinous head, which comes from the manubrium sterni, and this is the large fleshy part of this sternocleidomastoid, large fleshy head emerging from this clavicle, which is about medial third of the clavicle. And these two heads, they have a fossa, I'll tell you soon, in between these two heads, and they unite and go and insert it or superiorly attached to this mastoid process and the superior knuckle line and this external occipital protuberance. To this mastoid process, this is a very fleshy attachment, and this is the attachment to the superior knuckle line, external occipital protuberance, in the form of an aponeurosis. So this is the attachments of the sternocleidomastoid over here. This I told you the word lesser supraclavicular fossa. See again, this is present between, not shown clearly over here, but it is present above the clavicle between these two heads of the this sternocleidomastoid, which is this is the clavicular head, this big fleshy part, and this tendinous part from the sternal head. The sternal head and the clavicular head contains this lesser supraclavicular fossa. So this is I told you, this is a sternal head and a clavicular head. And so as we move on, this is also I've told you superior attachment of the muscle. And we also learned, and again I'm repeating, that these both muscles, the sternocleidomastoid as well as the trapezius, are enveloped in the fascia coli investing layer of the deep fascia of the neck. It envelops or invests this muscle, sternocleidomastoid. So what are the movements caused by this sternocleidomastoid? These movements, of course, occur at the craniovertebral joints, the joints between the vertebra and the cranium, and the cervical intervertebral joints. What are both these two joints, craniovertebral or cervical intervertebral joints? What is the unilateral contraction bring about, and what the bilateral contraction brings about? Two different things. So look at this diagram. This is the unilateral contraction. What will bring about? You see these arrows. This will cause a lateral flexion, right? And also the rotation. You see this would be the lateral flexion, and this would be the rotation. This is the thing. You read the text. Tilts head to the same side, laterally flex neck, and rotates the face. It turns superiorly towards opposite. So rotation is to the opposite side. This muscle is contracting of this side, sternocleidomastoid. Rotation is to the opposite side, and this tilting is the lateral flexion is to the same side, ipsilateral. So this will help us this action in understanding wry neck or torticollis. So this is the it's bilateral contraction. They contract on both sides. This is what is this movement? This, of course, is the extension of the neck. Extension. So brought about at the atlanto-occipital joint, but when they are contracting simultaneously on both sides, left and right, sternocleidomastoid. Right. So this is extension, and that is the similarly the simultaneously when they contract left and right sternocleidomastoid, they flex the chin, and it is close to the rod, close to the manubrium. So this is shown when the person is supine, flexion. So this is also the result, this movement, right? This going with flexion, and this is movement opposite the extension. And also this muscle is involved in the forced inspiration for what is the pump handle movements. Pump handle. This can elevate medial ends of the clavicles and manubrium and facilitates pump handle action of the deep respiration. So of course, nerve supply, motor is the spinal accessory nerve, supplies both the sternocleidomastoid and the trapezius, and the proprioception brought about by C2 to C3 nerves. It also, of course, causes the pain. It carries the pain impulses. Okay, test. Of course, if you do them to try to prevent the action, that will test the muscle. The person is asked to turn to the opposite side against resistance, hand against chin. So if it acts normally, the muscle, sternocleidomastoid, can be seen and palpated. And a few words about the trapezius muscle. Flat, large, triangular muscle. Covers the posterolateral aspect of the neck and thorax. So, of course, superficial muscle of the back, posterior axiopendicular muscle, and that already discussed, and the cervical muscle that can elicit movements of the cranium. So, the three characteristics. back muscle, axiopendicular muscle studied with the upper limb, and studied with the back, the superficial muscle of the back. And this is the cervical muscle studied with the neck that can elicit movements of the cranium. So it's head and neck. This is very long muscle having its origin. It's very long, which it's ascending part, middle part, and the descending parts or the fibers. So it attaches the pectoral girdle to the cranium and the vertebral column and assists in suspending it. You see the muscle here, and coming back to the picture, right? This is the trapezius, right? So its inferior attachments are not shown here, but you could see from here, right? This is attached to the lateral part of this clavicle inferiorly, and this is the acromion, right? And this is the lower attachment of these fibers, acromion and clavicle, and the spine of the scapula, and going upwards again to this superior knuckle line and the external occipital protuberance. This is the trapezius, and let's study it, how it is written over here. So this is the inferior attachment, lateral third of the clavicle, acromion, and the spine of the scapula. And superior attachment, external occipital protuberance, medial third of the superior knuckle line, of course the ligamentum knucki, and the spines of the C7 to T12 vertebra. So long attachment, C7 to T12 vertebra, and lumbar and sacral spinous processes. You see how it is attached. So this is the lumbar and sacral spinous processes. So nerve supply again same as sternocleidomastoids. Motor is a spinal accessory, and proprioceptive C2 to C3, which also carry the pain fibers. So its action is a shrugging of the shoulder, so it elevates, retracts, and rotates scapulae upwards. So then accordingly, these descending or the middle or transverse fibers and ascending fibers, their actions are elicited, right? And the descending fibers elevate the scapular shoulders and maintain shoulders level against gravity or resistance. This is shrugging of the shoulder. In the transverse fibers, what they do, they retract the scapulae, and the ascending fibers, they depress the scapulae. The ascending fibers depress the scapulae of the shoulder, and the descending and ascending fibers, when they act together, they rotate spine of the scapulae upwards. Right, so that is something, the mechanism of abduction, and that is learned with discussed with shoulder joint movements. So that is how they rotate. This is particular the rotation of the scapula, which is known as the wing nut rotation, right? So its fibers are involved in that wing nut rotation, with along with this trapezius and other muscle as well, the serratus anterior. So bilateral contraction with shoulders fixed causes extension of the neck. This is the trapezius action. And if one side muscle is contracted, it brings lateral flexion to the same side. How to test? Of course, shrugging is of shoulders done against resistance. If it is paralyzed, the shoulder will droop. Though the upper parts of the serratus anterior, etc., they try to compensate for that loss. They try to, and successfully, partially at least, compensate for that loss. So in clinical anatomy, very important is this torticollis or wry neck. You see, this is the wry neck. This is the wry neck. So what happens? It can be congenital, it can be rheumatic, it can be idiopathic. Congenital, which is occurring during childbirth, and during childbirth, the injury to the sternocleidomastoid, and its fibrosis and contraction results in wry neck. Its flexion deformity produces a tilt and rotation of the neck to the side of the affected sternocleidomastoid and restrict rotation to the opposite side. This is the thing, right? So this is a chin pointed away from contracted muscle. This is the contracted and fibrous muscle. So chin points opposite to that. And this is the head tilted towards affected side. right? This is affected side. This affected side held it till that way, and the chin opposite to that, away from the contracted muscle. This is away chin, and this is towards the affected side. Held toward the affected side. This is affected side, and the chin away from the affected. This is the position of the head. This is the torticollis, also known as wry neck. So it improves gradually by giving taking the child's position, correcting it during feeding and lying down. It gets generally corrected without any aggressive measurements. So this is idiopathic, which without any cause it occurs. Patient wakes up in the morning and he sees that it's very uncomfortable feeling the contracture, and this is sternocleidomastoid is, muscle is spasm. So you can also say this is a sort of spasmodic torticollis. So rheumatic torticollis is that which is produced when a person is suddenly produced to very cold temperature, and this is congenital torticollis. I have already explained to you. Thank you very much for listening to my lecture on this posterior triangle of the neck and the general aspect of the neck, its divisions into various aspects, the boundaries of the neck, and the various contents into that, and the torticollis. I thought it's very important and pertinent to know that. And there are also the most important things I've discussed, and you see. So this here I stop, and inshallah very soon I'll be coming with new topic, and thank you very much listening to my topic. I'm very, very grateful and thankful to you. Goodbye.